Hello dear friends, how are you today? I hope you are well. Here we are going to explain another question about dermatology. A 34-year-old man with a history of polyarthralgia, back pain and diarrhea is found to have a 3 cm red lesion on his shin, which is starting to ulcerate. What is the most likely diagnosis? A. Systemic Shigella infection. B. Syphilis. C. Metastatic colon cancer. D. Erythema nodosum. E. Pyoderma gangrenosum. Okay, here we can see a 34-year-old man with history of arthralgia, back pain and diarrhea with a 3 cm lesion on his shin, which is starting to ulcerate. This is likely Pyoderma gangrenosum is the best choice here, because Pyoderma gangrenosum in the patients with a history of polyarthralgia, back pain and diarrhea, which is the presentation of systemic disease, is an important. Here we are going to explain it. The answer is Pyoderma gangrenosum, as we said. Explanation: this patient is likely have ulcerative colitis, which has a known association with large joint arthritis, sacroiliitis, and Pyoderma gangrenosum. As we can see in this patient, the patient has polyarthralgia, back pain or sacroiliitis, and diarrhea. Okay, Pyoderma gangrenosum. Pyoderma gangrenosum, or PG, is a rare inflammatory skin condition characterized by painful, rapidly progressing ulcers, often with a blue or purple border. The blue or purple border of the skin, you can see in the border of the lesion, features typically on the lower limbs, especially shin, initially small red papules and later develop to deep red necrotic ulcers with a violaceous border or blue border, as we said, and may be accompanied by systemic symptoms, example fever and malaise. Causes of Pyoderma gangrenosum in 50% is idiopathic and inflammatory bowel disease like ulcerative colitis or Crohn's disease can be the result, and rheumatoid arthritis or systemic lupus erythematosus we can see in the patients, myeloproliferative disorders, lymphoma, myeloid leukemia, monoclonal gammopathy, like immunoglobulin E gammopathy, and primary biliary cirrhosis. As we said, their skin is the mirror of the body. Here we can see different presentations of different disease in the skin. Okay, management of Pyoderma gangrenosum. The potential for rapid progression is high in most patients with Pyoderma gangrenosum, and most doctors advocate oral steroids as first-line treatment. In most cases, oral steroids is a first-line treatment in Pyoderma gangrenosum. Other immunosuppressive therapies like cyclosporine and infliximab have a role in difficult cases. If the case is really difficult and treatment is crucial in cases, we can use cyclosporine and infliximab, which are a potent therapy. Okay, here we can see a black ulcer in the shin of this patient, which is Pyoderma gangrenosum. Here we can see ulceration of the lesion, and here the lesion is healing, and this one is the lesion is in there and a healing process. Okay, here was a short explanation about the patient, a 34-year-old man with a history of polyarthralgia, back pain and diarrhea with a 3 cm red lesion on his shin with the diagnosis of Pyoderma gangrenosum. Thank you for your attention.